Aetna has become the latest large insurer to forecast a loss on its Affordable Care Act plans for the year. The company is citing mounting medical costs and is now reconsidering its participation in the exchanges. Despite its ACA results, Aetna reported better than expected profit and revenue growth, which sent shares higher. Bertha Coombs has more on what Aetna may do next.
Aetna had hoped to break even on its Affordable Care Act plans in 2016, but now expects to post a $300 million loss, saying exchange plan members this year are racking up higher medical costs than anticipated, fueled in part by high-cost drugs.
Before, we were 150 million in losses. That was sustainable. Now we've got 320 million in 2016, and unless we get in front of it for 17, with some changes in the risk adjustment mechanism, we're not going to be able to afford it. We're not going to be able to continue to support it.
So now the insurer says it may cut back on its exchange participation in 2017. Aetna's move comes nearly 2 weeks after the Department of Justice sued to block its acquisition of rival Humana, as well as Anthem's deal to buy Cigna, in part over ACA.
These two mergers both threaten to reduce competition for the many Americans who now obtain health insurance through public exchanges established by the Affordable Care Act. These four companies have been among the most active in offering insurance through the exchanges.
Aetna says its exchange decision is not in direct response to the DOJ suit. The nation's largest insurer, United Health, announced its exit from exchanges earlier this year, and a number of Blue Cross plans are also cutting back for 2017. But without some of the savings that could result from the Humana merger, Leerink analyst Anna Gupta says Aetna can't afford to lose money on ACA plans.
They had guided to $1.2 billion in synergies just from reducing fixed costs with Humana. So, that can subsidize a lot of losses on public exchanges. And, Wall Street is relentless. So if they're not getting to a break-even product this year, next year it's going to be worse.
Aetna and Humana say they're committed to fighting the DOJ in court to complete their merger. As part of that effort, the companies reached a deal to sell some of their Medicare Advantage plans, representing nearly 300,000 members, to Molina Health for $117 million. The Justice Department declined to comment on the Aetna news today, the sale, or the exchange plans. For Nightly Business Report, I'm Bertha Coombs.